Okay, so we are in the month of, we're talking about mental health and medicine, and today we're going to be talking about self-advocacy with Dr. Damas. So for those who might not be familiar with any of the conversations we've had so far, is this our first one? No, this isn't our first one. What we're trying to talk.
This is like our third one.
This is our third one. Yeah, we're on our third one.
It's amazing.
I know. We're like 3 months in. 3 months in, right?
Yes.
But the idea behind this month is we're talking about how medicine and recovery intersect, right? And so, we've talked about the use of ketamine treatment, for example, and we've talked about prescription medications. And so now we have Dr. Damas on today. We're going to talk about self-advocacy as it relates to recovery and medications and just being in care in general, right? And self-advocacy as something that's important when it comes to care, because we need to be able to know how to ask for the things that we need, right? Like to level what might feel like a inherent power dynamic between patients and providers.
And it's a beautiful conversation because, like you said, being able to ask for what you need across the board.
That's right. Yeah. That's right. So Dr. Damas, we ask all of our guests the same 3 questions. We give you 3 minutes to answer all 3 of those questions. Okay. Don't worry about the time. We'll time you. Okay.
Ding. That's how I was going to do
it. Yeah. Okay. So the first question is, where are you from?
Where am I from?
Not like, where are your parents from?
What country did they come?
Yeah. Where are you from? Like,
I am from Los Angeles, California. A small town. Mid-city particularly. So if you know Los Angeles, like right off the 10 freeway on La Brea and Crenshaw.
Nice. That's we start with microaggressions. No. Where are you from?
No. Yeah.
But my family is all from El Salvador.
Oh, so okay. You look exotic. Where are you from?
Oh, I do have tan skin. Thank you.
So for folks listening, we're joking.
We are joking.
We are joking.
Okay. We are joking, especially
since we're all like shades of brown at this table.
It's like, So, and as far as recovery, what brought you to this recovery?
Well, that is an interesting question to ask, because I feel like my answer for that changes every month, right?
Oh, yeah.
At first, my recovery journey started because I just didn't want to die. Like, I was in a really awful spot. I was in a deep, dark hole, and I just saw nothing outside of that. And I just was like, this can't be the end. This can't be it. Now, when I think about my recovery, and I think that it's changed over a few months, and now that I have some time under my belt, I think about the fact that I genuinely love my life now. Mm-hmm. And I love my life, and I know that is because of recovery. So that's what's keeping me engaged and keeping me going, right? And so it's a complex question. I think it's changed. Other times it changed. I wanted recovery because of my job. I wanted recovery because of my friends. But I know that deep down inside, it's a collection of all those thoughts.
Yeah, I don't know if Anthony, I don't know if you noticed, I modified it to recovery to this recovery.
It was
because
great.
I really feel it, and I appreciate your answer. Go ahead.
Why did you say this recovery?
Well, okay, so I'm thinking about, like, we've had folks on who have relapsed.
Yeah,
we've had folks who are indifferent, and I feel like it's a little more open, because I know why I came into recovery, but this recovery and what I'm doing, you can even speak to the style of recovery they focused on.
Yeah, that reminds me of what Benji doesn't like, when how when people do chips and they go, "Are we all sober today?" Benji doesn't like that. He's like, what if you're, I'll tell you what his alternative is and why he doesn't like it. He doesn't like it because, like, the idea behind that is for there to feel like a feeling of inclusion. But if you're sitting there and you're drunk, you're not included. Yeah, that's true. So what he likes is when people say, "Are we all here today?"
That's a good
I know I've heard him change it, and they've changed that in CMA. They've changed it because for the same reason. And I'm all,
okay, San Francisco.
Are we all I changed it to, "Are we are practicing the step?" No. No,
please. Yeah.
No, there's value. There's value in what he's saying.
I appreciate that. That is actually very valid.
Yeah. So let's hit our last question before we jump in, which is, what is your relationship to your higher power?
So my higher power, I love my higher power. Let me just start off there. This is a entity. This is something that is always with me, that I talk to constantly throughout my day. And I've really relied, and that relationship has really strengthened in the last few months for me. which is not something that I had beforehand. And I find a lot of comfort in that relationship and in understanding that I am powerless in many things and that I need to trust the process, right? And I get very impatient. I get very flustered. I get very, I have all the range of the human emotions. And I love the fact that I have this anchor, which is my higher power, that I really actively seek guidance from. I'm always asking for, give me the spirit, turn me into the person that I'm supposed to become, like open my heart, like especially when I also have doubt in my higher power, which happens pretty often, strengthen my faith, and so I find a lot of comfort with my higher power, which I think, everybody's relationship is different, but in the beginning, it was something that I was like, oh, I believe in God. And yeah, it's crazy how that's changed over time.
Yeah, I used to have that too. Like when I first got here, I'm like, fuck that shit. But it's changed dramatically for me. So Dr. Damas, tell us like kind of briefly what motivated you to go into medicine.
So, as a child, I was sick all the time. And I spent a lot of time, I had like severe asthma and I just was hospitalized all the time. And my parents, they were, two undocumented immigrants from El Salvador. And so they didn't fully understand the healthcare system. They didn't fully understand like what chronic illnesses is. They didn't understand that you needed to follow up appointments and medication and so forth. And so I was actively always sick. And also, I love my parents and I love the experiences that I had, but it was a very traumatic household as well. And so when I was in the hospital, I had a lot of joy. Like I found it to be a very safe space for me. And I also realized like my parents, like really, this is now through a lot of therapy, realized that my parents like would always like, oh, the doctor's coming, yada, yada. And somewhere along the lines I was a child, I picked that up, I think, because my earliest memory has always been like medicine, doctor. And as I grew older and I, grew up in inner city Los Angeles, I realized that like, oh, this medicine or healthcare is a problem in the community. And I started to really kind of understand the specifics. And so it's been a accumulation, and it's also constantly changing as I've evolved and like grown wiser and older with that experience.
I love that. I love that there's like, it feels really personal. So it sounds like you have skin in the game, or it sounds like you've had skin in the game. Yeah.
When you go into, especially to be a medical doctor, it's such a rigorous journey. You have to give it your all. Like you have to sweat, blood, tears, like sacrifice. And so I had to really do all of that in order to get there. And, and this comes from, a little brown gay boy whose parents didn't go to college. So it was like a really rough experience in order to understand like higher education and navigation of that.
Yeah, of course. I love that. I felt that.
Yeah.
I felt like you just punched me in my chest.
You like that,
in the best way, you know what I mean? Okay. Louis, that was very beautiful.
No, exactly.
It was really, you're like, when you're used to be abused. What?
No, I didn't say
Does that sound familiar, Anthony?
Treat me badly.
Yeah.
Wow.
Okay, so
this is what I was telling you about earlier. It's like, Anthony does not.
We had to make it light. It was too. So I'm wondering. So given like how personal the experience has been for you, so growing up, were there any observations you made like as a young person, in medical settings or with doctors that made you feel uncomfortable, or things that you think may have informed maybe some of your like reservations?
Right. So, the reason I was really excited to come talk about this topic is because as a person who has recovery in mind and has suffered through addiction, I've also been the patient and I've also been the doctor. And so I have that interesting perspective where I've been on both sides and can see the different sides of that. And so growing up, like my mother couldn't speak English very well. And this is the time like in the 90s where people didn't really bother to get an interpreter or anything. And so I was like this 7-year-old kid trying to translate to my doctor that like, oh, my mom says that I keep getting sick and she doesn't understand what, right? And there was a clear kind of, like obstacle there in order for my mother to fully communicate the things that she needed to do, right? As a 7-year-old, I don't have an understanding. I don't have really, and she wasn't able to kind of talk about those things freely. And I saw that was one of the bigger obstacles, right? And as a Spanish speaker, I've been very privileged that when I was in the position of being the provider or the clinician, that I can talk directly to patients about that, because it really builds a sense of trust. And once that trust is established, then people are really like, this is actually why I'm here. This is what I need you to help me with. And so self-advocacy is something that I've really come to appreciate and really have done for myself. I've also struggled with my own self-advocacy. And as I've gotten older and understand what my needs are, I've been better at doing that.
Can you say more about like what your struggles with self-advocacy would have looked like?
So, you know, when I approached you at the party to talk to you about it. So when I left California, I went to medical school in the Midwest. I went to Michigan State. And in Michigan, I lived in this small town. It's called Grand Rapids, which is a very conservative side of Michigan, where Betsy DeVos is the former Secretary of Education, or Helen DeVos, this like money that really was pro-Trump at the time, right?
Yeah.
And so I get to this, and mind you, this is a big transition for me, right? I'm moving across the country. I don't know many people. I'm also actively using and drinking.
Mm-hmm.
And I start having a series of like a serious psychiatric episodes. Like I started, you know, under the influence, I tried once to like hurt myself and so forth, and I was hospitalized and so forth. And so when I got to the provider, who became my provider for the 5 years that I was in Michigan, immediately the diagnosis became like, oh, you have bipolar disorder, you have some sort of manic, you know, and just a long list of things. And at that position, I didn't know what I had and what I didn't have. And so I just accepted the things, right? And so as that relationship started to develop, the complications became where I was like, well, I'm in medical school now and I'm learning a lot about actual like manic episodes. I'm learning a lot about the actual psychiatric illnesses. And we had this kind of point where the doctor was very conservative in her approach. And what she was thinking casual sex was high risky behavior, which then was classified as mania / you know, bipolar acting up. And so for many years, I was on a very serious regimen of like depression medications and mood stabilizers. And to come out, you know, 5 years later after that, realizing I never had bipolar episodes. I never had bipolar disorder. And one of the things was the communication with my provider, and my provider not fully understanding, but also in the sense that I was not being 100% truthful to my provider about my use, about my substances, right?
Yeah.
And so it was kind of this back and forward, and it was just not a great time.
Yeah. You know what's interesting? Like, it's the thing that we were talking about before. This is kind of the same situation, you know, top up with like not trusting. Because I think it comes down to not trusting your provider enough to tell them the actual truth, because we think we go in and say, I tell you that I'm doing this and I'm going to be judged, or I'm going to be placed in a box, you know, or not given the common decency that you give just because I'm an addict or an alcoholic. Yeah.
And it was also very interesting.
Oops, sorry, go ahead. And I'm so eager. Go ahead. You're going to do your thing.
No, I was going to say there was also like these instances, Louis, where I was cruising in Michigan, or I was having anonymous sex. And that is what, you know, that's very typical here in San Francisco. Like you wouldn't think that that person's having some kind of manic episode or so forth. Like it's just really readily accepted in the culture. However, in Michigan, this was like a behavior that she found very alarming. And so there was a conflict of like, do I be my authentic self, or, you know, and it was a very long time before I was able to have the knowledge and the understanding of saying like, actually, I don't have this. I'm going to find another doctor. I need a second opinion, because my life was just like all over the place.
Yeah. And so thank you for bringing that up. I'm glad that we're circling back to this conversation, because I think it's interesting, right? Because on one end, it's a conversation of like cultural competency, as we were talking about off air. Yeah. And on the other end, it's like, when is sexual behavior like pathological, right? Like, and how can a patient have an honest conversation about sexuality, right? Because when I think about your situation, I feel like, oh, they didn't have enough information. You know what I mean? It's like they took that. I don't know the details of that, right? So I wonder a lot about that. Like, I wonder a lot about like this. I wonder a lot about what are the parts where like we need to be more culturally competent and interrogate, for example, what we're pathologizing, or in other words, like, when is it that we need more information before we start adding labels to people? And I guess if a person's on the receiving end, like as a provider, how would you like, I guess, to hear, or like, what are some suggestions you have for someone to like push back the way you did for yourself, right? Because that's a very rare thing that you did before you say anything. Like, to speak up for yourself is actually very rare. I don't like, it's hard for people to do it among friends sometimes. So within a medical context, right? So what are some of your ideas?
So, you know, the cultural competency is the key here, in the sense that, like, here in San Francisco, like, I, you know, go on a bender and then I can easily message my doctor and be like, hey, I need some doxycycline, like, send it to me. And without a doubt or without a blink of a question, they send me that prescription, right? That I wouldn't say that that's the exact same response that I would get in other areas of the country.
That's right.
So that's the big importance, right? Like, having, and my provider, I actively sought him. He is a gay man, and so I feel a lot more comfortable when I'm asking, like, hey, can you look at my junk because something's weird, right?
Yeah.
And it's having that comfortableness, that relationship of being like, I'm not going to judge, you're not going to judge me, and so forth. So that's really the key thing that I want to highlight, is like, you want to find a provider that you feel very comfortable with.
That's a great place to start. Like, when I would look for, like, anytime I would get insurance and I'd look for a doctor, I would always I'd start with, like, key stuff, like, knowing that I probably, you know, may need to change providers after a while, but I'm looking for, you know, would I be comfortable with a gay man, or a black man, or whatever, you know, and thank God each time I found this amazing doctor who was actually in recovery. I didn't know, but we have this language that we speak, and he figured it out right away. It was amazing. Actually, he had heard me share at a meeting.
Oh, no way.
Nice. Yeah, it's pretty cool. But then he moved away, and I'm all, please come back. No, go ahead.
No, so yeah, so one is like finding that person that you feel very comfortable, and then two, just being honest. And I think that's really hard, especially when you're in active addiction, right? And so, to give you an example, when I was using, in this scenario, I was lying about the amount of alcohol that I was drinking, and I was lying about the medication, the prescription medications that I was mixing with the alcohol. And obviously, I was having really intense highs and lows with it. And into the defense of the provider, you know, taking me at face value and believing everything that I'm saying, was adjusting all the medication in order to kind of help that, right?
Yeah, exactly.
And so I was in this vicious cycle of, like, I'm lying, you're trying to fix me, and then now you're making me sick, and I'm lying again, and it just became very, very hard. And so that's the second bullet point that I want to make sure is, like, be honest. Like, and so I'm going to put my sister on blast here, because she has a thyroid issue, and she didn't take her thyroid medication, and she was like, should I lie to the doctor that I don't want her to be upset with me. But she really loves her doctor, and she just didn't want her doctor to be upset. And I was like, no, because now she's going to think that you're taking the medication, and something's still wrong.
Yeah.
And now that it opens the box, as a clinician, you start thinking about all the other alternative possibilities. Is this a tumor? Is this some, you know, X, Y, and Z? But the reality was that she just didn't want the doctor to be disappointed in her. And so the second thing is about being honest of what's happening.
Yeah.
When I was in active addiction here in San Francisco, and I had my psychiatrist and my therapist here, I was very honest about my use. And I was also very honest about the way that I was ingesting things and so forth. And they stuck through me through the rough times.
So is it because you're able to see the nature of the relationship? Because what I'm thinking about, like, with doctors and lawyers, we see them in a certain place and hold them on this pedestal, but they're still providing a service. And if we were asking that of someone else, like in the service industry or whatever, no matter what's going on, we don't have any problem going in and giving it to them.
It's a service industry. Exactly. Yeah. You can go on Yelp and see the reviews of the doctors, and you can see what people say, what their experiences are like. And if you don't like your doctor, it might be challenging to transfer, but there are many other options, and it is a service that they're providing, right? And I really so being honest really helps the provider. And now let me switch over to my provider perspective. My provider brain is that every time that you're prescribing things or you're trying to give medication, you are taking the risk. You're analyzing the risk and the benefits, right? All medications, whether small or large, are going to have some kind of side effects. So you have to really actively look into the side effects, and you have to make does the benefit outweigh the risk when you're prescribing things? And that is another key thing. I think big pharma gets a lot of bad rap, and I understand that there's a lot of corruption in there, but as a provider, I've seen how like prescription medications used appropriately have changed lives in terms of psychiatric disorders, in terms of just like cancers and so forth. And so there is a really true, beautiful benefit of having them. However, if the doctor doesn't have the complete picture, it's really hard for them to have your best interest in that.
Yeah, thank you. These are all great points. So there's one thing I want to circle back to, right? Which is when we're talking about like access to resources, not everyone will have the ability to shop around for a provider, right? Maybe they're stuck at a clinic or, what have you. I'm wondering, so some of your suggestions still apply here, but I'm wondering if that changes your view at all, right? Like what happens when a person is stuck with a provider that they don't necessarily feel safe with?
Yeah, that's a really great point of view, right? A great perspective to have. And so the key thing when it comes to those interactions is that you come prepared to ask for what you need. If you don't ask for it, like if you know that you want to go into this, first of all, the interaction is probably going to be like 15 minutes, right? And so I always tell patients, I even tell my family this, and I tell my friends, is that you want to have a list of points that you want to address, and you want to have I need immediate addressing right now, and these can wait for another appointment kind of thing. And so if your intention is like, I need this medication, or I'm having this problem, I need you to help me fix it. As soon as the doctor gets in, it's like, how are things? You go right into it. Like, don't be shy about it. And so it's really about opening that communication and realizing that you go in with like an agenda of what you want. And so I really try to empower patients, especially patients who are really shy or get nervous. It's like, write it down on a piece of paper. And sometimes I'd have patients give me a piece of paper with their questions, and they'd be like, okay, let's check these things off. Right? Mind you, I have 15 minutes. And so I have to go through this really quickly because I have 10 other patients waiting for you. So it's about like, and the provider will really respect you because you've really thought about what you need and you are advocating for yourself. And as providers, or at least for myself, I really love seeing that. I really love seeing like, oh, this is what you want. Okay, let's do it. Like, how can I help you? Like, and when you get heard by the provider, it builds that relationship. It builds that trust.
That's excellent. So I want to pivot a little bit, and I want to talk about addiction medicine specifically, right? So one of the things that I think a lot of people aren't familiar with. So for example, not too long ago, I was talking to a newcomer who was struggling to get sober. He texted me, he's like, I can't stop. I really can't stop. I can't stop. I can't stop. Right. From your perspective, where is a good place for that person to start?
And so from a clinician perspective, is the understanding of, do I need to go into an inpatient? Do I need to have like a higher level of care? And so when it comes to addiction medicine, so I've been in harm reduction, I've been in IOP, I've been in outpatient, I've been inpatient, I've done all the tiers of that. And you probably know this much better. It's about the level of support that you need. And so somebody who's not able to stay sober and they're actively using and putting themselves in harm, then a higher level of care, like being an inpatient, might be the best scenario. Now, how do you get a referral to one of those things unless you have the money to fund the whole thing yourself? But it's better to have a provider write that referral, so then your insurance can cover it.
Yeah.
Could you say a little? You mentioned very specific forms of treatment. Can you talk a little bit about what those are? So, for example, like I think one of the things that you were gesturing toward are like when you talk about higher level of care is like, does a person need to go into like medical detox, right? Or if steps down from that, can you just kind of like, for folks listening, just peripherally explain what the tiers are?
And so the highest level of care is going to be your inpatient and your medical detox, right? And some people just require 24-hour support. This is where you go to an institution or you go to the hospital. You'll have staff there who just checking your medical vitals and so forth, giving you the appropriate medication. The detox perspective is you really worried about complications of detoxing seizures, one of them delirium tremens, all these other kind of things that can happen, and you do need medical supervision to do that. And so the inpatient is usually 30 days. It can go on to be like 60 to 90 days. And this is where you're kind of building a community and you're being observed all the time. This is a great place to be, especially if you're having significant challenges of that. Now, the step below under that is called a partial hospitalization, or PHP. And this is where you're basically going to some program 5 times a week, and you're going for about, I want to say 5 hours a day. And you're going Monday through Friday from like 9 to like 3 p.m. or so. And during that time, you're basically working and building your DBT skills. You're working kind of like meeting a community, and you're getting kind of all the resources and whatnot. This period is usually maybe a 2-week period, because you're like in transition, right? You're no longer needing to be supervised all the time, and now you can move on to the next level. Underneath the partial hospitalization, you have the intensive outpatient program. This is going to be 3 times a week for 3 hours. And all of these programs, you have like weekly drug testing. You'll also have like a counselor or a therapist. You'll have process groups and so forth. But the intensive outpatient program, you'll have for 3 hours, 3 times a week. You can start working. You can start integrating into your life and so forth. The step underneath that is going to be your outpatient program. And this is going to be 3 hours, 1 time a week. Again, you'll have drug testing, you'll have like bi-weekly meetings with your counselors and so forth. So those are kind of like the spectrum of things that of the different levels of care that you can have. I want to put this out there because I went in all these levels. I did really well in an inpatient. Like, I'm being supervised all the time. I'm the perfect student. Now you let me go on my own. Now so for me, I really had to go into an IOP, a PHP, in order to be successful, and how to integrate my life when I'm not being supervised all the time.
Yeah, and what I'm hearing you say there, and then we have a comment, what I'm hearing you say there is that one of the things that people can get honest about is like what they're feeling that they need, right? Like, do you know, for example, like I need, like, you know, like my body's shaking, I'm not able to kind of, I feel disoriented, or do I know that like maybe I don't need that high level of care, but I know that when I'm by myself, it's very hard for me to stay sober. Let's see that comment. Jaylon writes, how would someone who is super willing but uninsured go about getting treatment if they need a higher level of care? P.S. I love you, Carlos.
While you were talking, one of the things that, like, when I was working for the Black Coalition on AIDS and doing outreach, I was always encouraged by talking to people about, especially when they were unable, when they didn't have income or resources, to look into God, I just thought, no, it's give me a second.
So we can come back to it?
Let's circle back. I'll remember.
Yeah, we can circle back to it. Did you want to address Jaylon's question?
Yeah, Jaylon, so that's a great question. So it's also I have a perspective. So when I lost my job, I lost my insurance, and my active addiction was like off the roof. And I knew that I needed help. And then navigating healthcare, at least in San Francisco, is such a challenging thing. So I needed to apply to Medicaid, right? And so I needed to get some government assistance in that sense. Now, through that, there was different programs that are accessible to me that are going to have that kind of higher level of care. And I believe in San Francisco, we have the Salvation Army, and then we also have the Health Right 360. Now, how this works is that you need to call one of these places beforehand, and they're going to tell you when you need to come in for an assessment. You go in for the assessment, and during that assessment there is hopefully when you kind of tell them that you need this extra level of support. And many times they will take you immediately if there's space. Now, the problem is that there's not always space available, right? Yeah. And so this is one of the things that I would suggest is kind of make sure that you are in the San Francisco healthcare plan, and just to have the insurance. And then, because you should qualify based on being a San Francisco, living in the city. And then you start exploring your possibilities with these 2 options. Now, if you go to the San Francisco health website, you'll see how many beds are available at these sites. And then you can call them and say, hey, I need higher level of care. I'm interested in being here an inpatient. How can you help me? And they'll give you the instructions on how to do so.
And I think, go ahead.
No, what I was going to mention, the program, case management. There's so many programs, so many ways that individuals who are lower income, who don't know, can start with case management, and almost like that case manager is an advocate for what you might need, because that's what I did. I saw an opportunity, and I was able to kind of talk with an individual, and they act as the buffer in a lot of ways and got me to where I needed to be.
Yeah, and I think that this is maybe that we need to have a continuation to this conversation, because our audience is not San Francisco specific. Like we have an audience across the country and in other countries. So I'm wondering if like maybe we can have a continue. I'm thinking out loud. I'm wondering if if we have a
Are you inviting me again?
Yeah, you should come back.
Yeah, like next week.
Yeah, if you want to come back next week, because you think about it.
I have Zumba class on Tuesdays.
Yeah. You have Zumba class on Tuesdays.
I do, but I was willing to move it. So my instructor Maritza is going to be like, "Where are you?"
Aw. I used to take Zumba a long time ago, and I really liked it.
I did.
It was a lot of fun.
I took Zumba at like
where do you go to? Is that where you go?
I go to 24-hour fitness.
Nice.
I'm gonna take a Zumba class, but you take it during this time.
We can work things out.
Okay, yeah. Let's do a Zumba class together.
I need my schedule.
Friends that are healthy together, stay together.
Absolutely.
Okay, so I do think what I want to acknowledge is, like I did a second ago, which is that we're very fortunate in San Francisco in that there are a lot of resources available for people, and I think maybe one of the conversations that we might consider having is like, okay, what if you don't live in San Francisco, right? What if you're addicted to medication? What if you're like addicted to meth and you live in like rural Arkansas and you're gay and you don't feel right? So I mean, there's just I think we have to do some research there.
And I was gonna say, this is a great place for self-advocacy, because you have to do the research. You have to go look on what is provided in your community. You have to really look for those things.
Yes. Okay. We have another comment. Louis?
Anka, I work at home reduction model, which is great for clients, but can be frustrating for providers. If we're being honest, how does Dr. Carlos manage his own emotions when clients make decisions that are not in their best interest? I find it heartbreaking sometimes, but at the same time, I get that they have agency over their journey.
That is a great question. So one of the
thank you, Anka. Thank you, Jayla.
Yeah, thank you, Anka. One of the things that is really important is to meet your patient at where they're at, right? And so if they only can do harm reduction, so then let's maximize harm reduction. How can we minimize the damage that you're doing? If you feel like you have the ability to, and this is where you do motivational interviewing, you kind of assess where the person is in terms of like what level of readiness they are in order to get care. And let's just be realistic. And so this is also coming back to this idea of like being honest with your provider, but also being honest with yourself. What is possible for me, right? And I sometimes, at least from my perspective, was I wasn't ready for full on sobriety. I wasn't for 100% abstinence. And so when my providers met me at harm reduction, it was successful for that time. And then some people can keep that up. For me, unfortunately, it didn't work out. And so I would say that as a provider, you have to just kind of realize that you don't take things personally, because the patients are, they live in their world and they're not directly trying to upset you, first of all. And the second thing is like, how can I meet them at their level where they're going to feel comfortable to come back and also comfortable to tell me the truth, so we have this honest, fulfilling relationship between us.
I love that. And we have another comment. Let's see. Is this Mindy writes, what can one do if they live in a rural area where they want to get a bed and a detox or treatment center, but there are no beds available and there's a long waiting list? Mindy, so this is a very good question, right? And this is something that I think is going to take a bit of research on our part, because I think Dr. Damas, I think you've gestured toward this, but basically it's, it starts with having to do research, right? And in whatever way that looks. Sometimes, did you have something you wanted to say?
No, I was just going to echo what you're saying, that I need to do some research in order to make sure that I give you the most, accurate information when it comes to that.
Yeah, Mindy. So I think that's something I want to be responsible about addressing that question. So I think that's something that we're going to bring into next week. But I think some things that people can take with them are, one is that, do research if you have access to the internet. Even asking around, like speaking to close friends, sometimes we have to tap into our personal networks. Sometimes whenever I think about these kind of things, like in my head, I always think like worst case scenario. So like, you're in the middle of some rural area, you're stuck in some home, you don't have access to the internet, you don't have a phone, like I suppose we wouldn't know what was going on with those people, but that's when I think like worst case scenario, like that's what we're thinking about.
If you have like, if there's the will, there's a way, right? And so like if you were in that situation, like the public library is accessible to you and has free internet and has resources for you to use. I love the public library. So this is my plug for my public library.
Yeah, every time I move somewhere, I always have to find out where the library is.
Love the library.
I used to, as a teenager and when I was in middle school, I spent a lot of time there.
Also, interesting enough, like I follow the San Francisco Public Library sends me emails every week about the events they have. And they have like specific groups, which I'm not sure if it's across the country but they have groups if you're interested in recovery to go to these groups. They have like information sessions. And I'm assuming that other states are also trying to kind of follow that model of like, maybe you're just interested in hearing about it. Here are the resources. And so it would be really good to check that and also do like the public health, just check on what your county has and what resources are available just to start off.
And you know what, we would be remiss, or I would be remiss in saying there are 12-step everywhere.
Exactly.
And sometimes
true.
It's just a matter of connecting with folks in those meetings, because there may be someone there who can share their experience if they've gone through it.